Good evening, everyone, and thank you for joining us tonight for Illinois Bone and Joint Institute's 25th Virtual YMCA Education Series program with the North Suburban YMCA. My name is Karen Brownlee, and I'm a personal trainer and the Adult Program Coordinator at the NSYMCA in Northbrook, Illinois. We are recording this evening's presentation so that you can revisit it again. Please feel free to tell your family and friends about it so that they too can view it on either the IBJI or the NSYMCA websites. Tonight's program will be hosted by Dr. Inbar Kursin and Dr. Lynn Gelman-Shahab. Tonight, you will learn a multidisciplinary approach to address adult and pediatric metabolic health and weight management, along with health and wellness parameters that include optimizing nutrition, reducing stress, pain-free movement, improved sleep habits, and enhanced overall performance. The physicians will explain the importance of these fundamentals so that you can reach your goals by focusing on reasonable and sustainable changes that help optimize long-term health. Dr. Kursin has a passion for teaching and a genuine commitment to educating her patients and the community on leading a healthy lifestyle. She has been seen all around the Chicago area giving seminars and lectures focusing on how to use food as your best medicine. Dr. Kursin earned her medical degree at Rush University Medical Center and completed her residency at Lutheran General Hospital in obstetrics and gynecology, where she earned numerous awards for her compassion, excellence in care, and teamwork in the treatment of patients. She went on to pursue advanced training and education in obesity medicine and is a diplomate of the American Board of Obesity Medicine. Fun fact about Dr. Kursin: she was born in Haifa, Israel, where the delivering OBGYN fellow later became her maternal fetal medicine attending in residency at Lutheran General Hospital, demonstrating that it is indeed a small world. Dr. Kursin combines her 20+ years of clinical experience with her passion for improving metabolic wellness to help every patient achieve their optimal health. Dr. Lynn Gelman-Shahab is a pediatrician who has focused on healthy weight management at both the individual and community level for more than 20 years. She is a graduate of Stanford University Medical School, and after her residency in pediatrics at University of California, San Francisco, and Mount Sinai hospitals, Dr. Shahab completed a master's in public health and a fellowship in urban community health at Columbia University in New York City. Dr. Shahab serves as an advisor to the Evanston and Skokie health departments, as well as local school wellness committees, to help promote simple, evidence-based messages that truly impact health. Her Rethink Your Drink materials are all around Evanston and Skokie, in schools, local businesses, community centers, and many other public health spaces. Dr. Shahab can often be seen giving talks about the impact of diet, sleep, and stress on weight to both colleagues and the greater community at local schools, hospitals, and organizations. Tonight's fun fact about Dr. Shahab is that you may have seen her alongside her husband, Dr. Eric Shahab, when she was an extra on the television series ER. She and her husband are still waiting to be discovered to pursue their television careers. Thank you again for joining us this evening, and thank you, Dr. Kursin and Dr. Shahab, for your time and effort in putting together tonight's presentation to help us better understand metabolic health. Now, doctors, please take it from here.
Thank you so much for that lovely introduction. Lynn and I are very happy to be here tonight, and we're excited to share what we know today with you. We're going to talk a lot about how to eat, move, and live in a healthy way. So we wanted to start tonight by explaining what is actually good metabolic health. And good metabolic health has to start with having good energy throughout the day. If you don't have good energy throughout the day, that's kind of your first sign that you might need to change things about your metabolic health, about the way you eat, sleep, move, all the things we're going to talk about today. We want you sleeping well and feeling well rested throughout the day. We want you to have optimal levels of cholesterol and blood sugar to help prevent future disease and to keep low levels of inflammation, because we know that inflammation, as we'll talk about today, is the root cause of a lot of diseases. And so that's an important part of having good metabolic health. And of course, being happy with your weight. And doing all of this in a way that is easy to maintain and allows you to enjoy your life. You don't want to be stressing all the time about all the various things that you're doing to try to stay healthy. You want these things to be kind of ingrained as habits in your day-to-day life. And so we hope that after today, you'll have some actionable, pragmatic items that you can start implementing to help you on your journey to better metabolic health. So we want to talk a little bit about what has been the impact of COVID-19, or rather, really a better term would be what's the impact of the pandemic. And we know that prior to the pandemic, rates of obesity were increasing in the United States, and rates of poor metabolic health were increasing alongside that in the United States. And if we look at this graph, this is looking at a survey of 111 million people around the United States taken through the electronic record called Epic, which you may have heard of. But a lot of hospitals use Epic and a lot of practices use Epic. And Epic did a study where they collected all this information and they looked at the trends of people's weight from before the pandemic and after the start of the pandemic. And so you can see that red line that shows the National Emergency Declaration on March 13th, 2020, exactly 2 years ago. And that was the start of the pandemic. And if you look at the dotted line, although obesity rates have increased, they'll look at the dotted line, the trajectory has stayed the same. So the rate at which it is increasing is the same in adults. Dr. Shahab will kind of show you later on that that's not the case for pediatrics, but at least for adults, that is the case. However, this study also looked at if you identify the patients who lost or gained a certain amount of weight, the study showed that the same number of people lost weight and gained weight at the same rate before and after the pandemic. So the green line is pre-pandemic, the yellow line is during the pandemic. And so all those lines, whether you lost 2.5 pounds or gained 2.5 pounds or lost 12.5 pounds or gained 12.5 pounds, you can see that the lines kind of line up. They're not significantly different. And that is very interesting because we know a lot of people, at least in our practice, have complained about weight changes that they're not happy with that occurred during the pandemic, and they're looking to make changes. Like a lot of us, we've struggled during the pandemic for many reasons. But if we look at the reasons, kind of the impact on adults during the pandemic, and this was a survey done through, I think, American Psychology, it showed that 2 out of 3 Americans reported pretty significant sleep disruptions during the pandemic. And part of that is because you can't separate work and home. You're working out of your house, there's no clear separation, you're not commuting back and forth, and so you don't have that some downtime in between the time that you're working and the time that you're trying to go to sleep. We also know that 1 in 4 adults reported drinking more alcohol. I mean, how many of us had suddenly happy hour every day at the beginning of the pandemic? That was a really common thing, and alcohol sales went through the roof. It's also reported that about half of parents said that their levels of stress increased, right? Because their kids are sitting at home. Now they're responsible for helping their kids learn virtually, in addition to also taking care of their work and other responsibilities, and it made it a lot more challenging. We had already a worsening mental health crisis before the pandemic. It has, exponentially grown during the pandemic, and almost half of young adults are now reporting worsening mental health. And I think it's staggering to understand that 61% of adults reported an undesired weight change during the pandemic and gaining an average of 29 pounds. So even though the studies show that pre-pandemic and post-pandemic weight amongst adults didn't change, our perception of that has significantly changed in adults.
And the pandemic has absolutely been devastating for the health of children, both their physical and their mental health. So you expect children to gain weight as they grow. That's the expectation. Another really good study that looked at a huge electronic database comparing a 9-month period right before the pandemic to a 9-month period in the height of the pandemic found that children gained double the amount of weight during the pandemic than they did in the pre-pandemic period. And children who are heavier, who had obesity, tended to gain the most weight. So if a child in the pre-pandemic period, if the average weight gain for a 5 to 12-year-old was about 1.5 kilos per year, during the pandemic, it was 3 kilos per year. And the prevalence of childhood obesity increased. We've had steadily increasing rates like adults since the 1980s, but in the last decades, our rates have pretty much plateaued around 17 or 18%, depending on the survey. This study found that if you looked at the prevalence of pediatric obesity in August 19, it was 19%, and it was 22.4% in August of 2020. And that's a huge jump in 1 year. We also know that the mental health of children was really dramatically affected during the pandemic. So like adults, we also had an increase in mental health issues among the pediatric population, but this skyrocketed during the pandemic. And it's not a surprise, right? I mean, when children are isolated home from school, not being able to look forward to any of the activities they usually do, their parents are stressed. There are many children who lost family members due to COVID. It's not a surprise that we've seen this dramatic increase in mental health issues. One example is that ER visits for teen girls for suicidal ideation increased 50% in 2021. And again, that's a huge, huge jump. And if you look at any teacher websites or talk to any teachers or talk to school social workers or people who work in schools, they all report that this year, even though most children are back in the building, there's been a real dramatic increase in disruptive behaviors, in fights, in vandalism. And we've even seen an increase in school shootings. So in 2019, there were 19 school shootings. Obviously, there was no school for a lot of people in 2020. In 2021, it was 28. So again, huge increases, and it all just shows that just people are really stressed and really suffering. And when we think about what contributes to weight gain, it's poor nutrition, it's lack of physical activity, it's not getting enough sleep, and it's being under stress. So I think pretty much any of us can think back to the dark days of March and April 2020, and I'm sure we were affected by, probably all 4 of these things, but at least it would be hard to find one person who wasn't affected by one of them. And again, when you think of children, school provides so much structure for them. It provides an opportunity for physical activity. And for many children, it provides an opportunity for better nutrition. A lot of children get breakfast and lunch at school. Having a school structure usually helps with sleep hygiene. And again, all of this went out the window during 2020, and adults and children really suffered.
Yeah, and I think for adults, we can easily identify the issues that come along with all 4 of these categories. If we start just with nutrition, the fact that we were at the beginning kind of going to grocery stores only once in a while and trying to stock up on food that was mostly non-perishable, or we eventually started ordering in again to support local businesses where we're not necessarily cooking the best meals because we also don't have as much time because we're, again, not separating work from home life. We're dealing with helping our kids with school, on Zoom. And so that added to the stress, in addition to the fact that anytime, the stress also came from the fear of the pandemic. It came from the fear for our kids and what they're losing out and the anxiety over that. It came from what's going to happen to the world. And it came from lack of sleep. If we're not sleeping well, because again, we can't separate our time, we're worried about things, then our stress level goes up. And we were no longer commuting. We were no longer, going to gyms and going to do our, meeting up with friends and taking walks. We weren't doing the activity and simply just sitting at home, working from home, walking from our office to the fridge or from the dining room table where most people spent their time doing their work. There was just such a difference and such a disruption to the daily routine and daily life And in addition to that, there were trends all over social media about bread baking and, having cocktail hour and all these things that affected us in a way that we weren't prepared for, our bodies weren't prepared for. And so all of that will raise your hormone called cortisol, and cortisol will increase the amount of weight we pack on, or that our bodies hold onto. And so it's actually, this kind of Venn diagram sums up a lot of what happened during the pandemic when it came to our metabolic health. And understanding that, again, coming back to this concept of inflammation. And when we talk about inflammation, we're not talking about just, you bump yourself and you swell, from a bruise. We're talking about inflammation that is a whole bunch of chemical substances that are floating around in your body that are released in response to stress to the body that end up causing damage or injury to various organ systems that lead to these diseases. So everything from cancer to liver disease to autoimmune diseases, asthma, Alzheimer's, diabetes, heart disease, all of these things are involved and are impacted by inflammation. And inflammation is in turn turned on by excess weight, by stress, by all the things that we're talking about. So improving your metabolic health will reduce your inflammation and will help you achieve better balance in your life between your nutrition, your sleep, your stress, and your activity.
So again, let's just review what is good metabolic health. It's having energy out throughout the day. It's sleeping well and feeling well rested. It's having optimal levels of cholesterol and blood sugar to help prevent future disease and to help decrease inflammation. And it's being happier with your weight. So again, we know the pandemic threw a monkey wrench in the metabolic health of many, many people in this country. And now we're going to advise everyone on ways to get your metabolic health back on track. Just a few simple habits that will improve your metabolic health. So we're going to start with how do you get better sleep and how do you reduce stress?
But so I think we're going to come back to this idea of what does sleep deprivation and stress do to our bodies. So when we are sleep deprived and we are stressed, we actually have an increase in hunger hormones because the body is in survival mode. It needs energy and it's seeking energy and it's going to look for food for that source of energy. We're also awake more hours and we stress and emotional eat. And so we have more opportunity to eat, and combine that with the fact that we're always stuck at home, we definitely have more opportunity to eat. I don't know if any of you have noticed, but when you're tired, your body's kind of cold, and that is because we have altered body temperature regulation. And again, that drives our bodies. If we're trying to force through that fatigue and not sleep as well, we are overeating because we're looking for energy. And that fatigue also makes us it gives us less desire to move. And all of these things combined will cause that weight gain that we have noticed.
So we're always asked, what is the appropriate amount of sleep? What is the right amount of sleep for children and adults? For adults, you want to aim for at least 7 hours of sleep or more a night. And for teens, you want it to be 8 to 10 hours. And for younger children, even more. Elementary school children should get at least 10 hours. And obviously, we all know that babies sleep most of their day. And this is the data that we have is from 2014. This is all from the sleepfoundation.org. So especially parents of teens, when they ask you, well, how do you know this? How do you know I need to get this much sleep? Send them to sleepfoundation.org. They have lots of great studies. But the data they have is from the most recent data we have from our national surveys are from 2014, and they're self-reported data. So a third of adults reported that they get less than 7 hours, and about 27% of teens reported they got less than 8 hours. And remember, this is self-report. So this is a gross underestimate. And again, I work with a lot of teenagers post-pandemic, their sleep was very disrupted by a lack of schedule. And I would say in my practice, I would say maybe 50% of my patients get 8 hours of sleep or more.
Yeah, I think with adults, it's also true. I think adults, because there's that lack of separation between work and home, and also so much stress. I mean, so many people left their jobs. And so there's been a lot of added stress for people who stayed in the job to take on more work. And so their minds are going at night. And I think people need a chance to unwind and relax. And so they're staying up later, scrolling through social media, watching TV, just playing games on their phones. And that stimulation is making it much harder for them to sleep. So overall, I think adults are also getting a lot less sleep from what I'm seeing.
So then what can you do to get that good 7 hours of sleep or more if you're an adult, or 8 to 10 hours of sleep if you're a teenager? One thing is try not to eat for 3 hours before bedtime. Our bodies have what we call a circadian rhythm. And in a 24-hour cycle, our body goes through many different processes based on whether we're seeing light or dark. And so at night, we're supposed to be shutting down and digesting. And if you're eating at a time when your overall circadian clock is telling you it's time to rest and digest, your body can get confused and it doesn't appropriately digest or process that energy that you're eating right before bed. Another key thing is you don't want to watch any screens for an hour before bedtime. And this is my biggest issue with teenagers during the pandemic, because phones were such a social lifeline for them that a lot of us, including myself, got very lax about rules for phones around bedtime. Dr. and Kirsten and I joke about this in our own homes, but you really, for children and teens especially, and even for adults, you really want to put that phone out of their room. And a lot of times I get the answer, well, I use my phone for an alarm clock. You can buy an alarm clock at any Walgreens or CVS, between $10 and $20. Like it's really critical to get that phone out of the room, especially for younger people where it's really hard to, resist that temptation. And then the idea also is you want to kind of shut down and unwind as you're going to sleep. And a lot of us, as we lie in bed, sit there and think about everything we need to do for the next day or the next week, and find it hard to go to sleep because we're trying to remember what we're supposed to be doing. So if you can keep a pad of paper and a pen next to your bed, and as you're getting into bed and going to sleep and think, oh my gosh, I need to make this appointment or do that, and write it down, then you let go of that thought. Okay, I'm going to wake up in the morning, I'm going to see my list of what I need to do, and then you're not ruminating about it for hours while you're trying to go to sleep. And I always like to say we were meant to sleep in a cool, dark cave. You want your room to be, the room temperature to be low. People sleep better in lower temperatures. Whenever you read an article about Tom Brady, I think he sleeps in like 60-degree, a 60-degree bedroom to optimize his sleep. And you want it to be dark. So it's always good to invest in good shades or good curtains, and really get a bedtime ritual that just, again, with this, as Dr. Kirsten mentioned, we've had this terrible lack of separation between our school day and our work day and being at home. So get into a bedtime ritual that tells your body, we're done with school, we're done with work, it's time to go to bed. And that could be reading a book, it could be listening to music, it could be a meditation, a shower, but just something that just signals to your body that work day is done, school day is done, now it's time to rest.
So, Dr. Shaham, funny story about that with my own teenager. My youngest was very reluctant to give up her phone to go to sleep. And she said, then I need 5 alarm clocks to wake me up because I'm not going to wake up to just one. So guess what mom did? Mom went out and bought 5 alarm clocks at Target. And she put 3 around her room. I was able to return 2, but it did work and her phone is out of her room. So thank you for that.
Right. And yeah. It's ideally, as a family, you have one central place where the phones go, and they go there at different times depending on different ages, just so we're modeling for our children just what's a good habit. Because really this is what this whole talk is just creating good habits.
Yeah, and I think, your comment about the cool dark cave, I've read that for women especially, keeping your room at night less than 65 degrees is kind of the magic number, because you need your body to cool down in order for the body to settle into sleep and into a good deep sleep. It's not just falling asleep, but we want that really deep sleep, because that's the restorative sleep that our body needs to repair. All right, so talking about stress, we've just finished covering stress and sleep, and they're very tied together because they both raise a hormone called cortisol. And cortisol raises a hormone called insulin. And insulin you guys may have heard of, but insulin is basically the storage hormone in our body, and it is most responsive to the amount of sugar we eat. And so it's just interesting to me that stress is dessert spelled backwards, because they're very much linked. So we're going to talk a little bit about how what we eat influences the way our bodies fight disease, because it is very true that that is what happens, and what we eat affects our mood, our energy, our overall sense of well-being. If you've ever gone out and had, kind of a more, a less desirable meal, or a less, what you would categorize as a less healthy meal, and then another time gone out and eaten really healthy, you probably already sense that difference. It's just hard sometimes to make that decision to always eat healthy. But we know that food is the most important medicine we have. And so if we learn to use food as that medicine, we can often really improve our mood, our energy, our sleep, our stress, our, everything. And in addition, if you are looking to lose weight, it will help with that as well. But if you're just looking to improve your overall metabolic health, food is your best weapon.
So the first place to start, or what we think is the easiest place to start to improve your diet and reduce inflammation, would be to decrease added sugars, because Dr. Kirsten mentioned this hormone insulin. And when you eat sugar, your insulin is raised in proportion to the amount of sugar that you eat. And that whole raising of the insulin sets off a cascade that can lead to increased fat storage, inflammation, and is really the root cause of many, many different chronic diseases. And we start with sugar because, one, it has such a profound effect on your metabolic health to decrease it. But the other reason is you do not need sugar. So we would die without protein, we would die without fat. If we didn't eat fruits and vegetables, we wouldn't get the fiber that we needed, we wouldn't get the vitamins that we needed, and probably have horrible issues with constipation. But you do not need sugar. And we are always asked, what's an added sugar? Added sugar is anytime you look at a label, and we're going to go over all the different names for sugar, but you see sugar on the label, that means it's not naturally occurring in that food. But luckily, in the last few years, labels in the United States are required to differentiate between natural and added sugars. So when you get a food product, you look for sugar or a form of sugar on that ingredient list, you look under carbohydrates, and it will say total amount of carbohydrates, total amount of sugar, and then total amount of added sugar. And a good rule of thumb to think about for what should be your sugar budget would be no more than 24 grams in 24 hours. Now, again, you don't need to have any sugar, but we all like sugar. So if we want to kind of start at a place of how to limit our sugar, this is an easy number to remember: 24 grams in 24 hours.
So when we talk about sugar, we like to help people understand how to quantify, like, why is it 24 grams in 24 hours? Well, one of the reasons is because our body likes to maintain a certain blood sugar. And when we go above that certain blood sugar, we develop diabetes. And that's the definition of diabetes, is too much sugar in the blood. So if we understand how much sugar our bodies can tolerate, and everybody's body is different, right? So some people can tolerate more sugar than others, but in general, we want to keep that sugar low because of the things that sugar can do to our bodies. So when we explain to patients how to calculate sugars in their diet, we explain to them that 1 teaspoon of sugar is about 4 grams of sugar. So that means you are allowing yourself about 6 teaspoons in 24 hours for that 24 grams. And ideally, you're getting that sugar from some better sources and not from, and you're not getting them all at once, because the other piece about it is in your body is trickling in that sugar over 24 hours rather than dumping it all in at once when your body has to release a whole bunch of insulin to get that sugar out of the bloodstream so that it prevents diabetes. If we are able to keep the amount of sugar coming into the body at any given time, at one time, then the body has time to handle it and to get rid of it and to not allow it to cause as much damage. So when you're looking at a label, that's one thing you should do, is kind of look at the amount of sugar there is, divide that by 4, and that will give you the amount of teaspoons of sugar, and then you can calculate out your 6 teaspoons of sugar in 24 hours. And if you Google 56 different names of sugar, you'll find various different graphics that will list all the sugar. It is pretty appalling that if you go to a grocery store, we always talk about shopping the perimeter of the grocery store, because that's where you're going to find your produce, your fruits, your vegetables, your fish, your meat, and maybe some of the home-baked breads, like the stuff that's a little bit more, baked with pure ingredients. And in the middle, where you find all the processed and packaged goods, and that's where you're going to be reading labels and looking for these items named the 56 different names of sugar and calculating out your teaspoons of sugar. So these are great rules of thumb to just kind of keep in the back of your mind when you're shopping, so that you can identify these things and try to, avoid these 56 different names of sugar and stick to more naturally occurring sugars in your diet.
And in the American diet, the largest source of added sugar comes from what we drink. So this is a graphic off the USDA website, and almost half the amount of sugar that we consume comes from beverages. And what's interesting is that over the past 2 decades especially, we've seen a decrease in soda consumption, because I think a lot of people know that a lot of sugar hides in soda, but we've seen increases in other drinks that are usually advertised as healthy, such as some of the sweetened teas that are labeled as, having antioxidants or vitamin C, or juice, which I consider juice an added sugar, because even though sugar occurs naturally in fruit, juice doesn't occur naturally. It goes through a process to make that juice, and our juice tends to be concentrated. So if we were going to squeeze, 6 oranges to have a little glass of orange juice, a concentrated same glass of orange juice might have twice that amount. And then we also have to think of all the sports drinks, the energy drinks, the coffee drinks. I think a lot of people are shocked at how much sugar can hide in a caramel macchiato or a coffee drink. And then again, other healthy drinks like vitamin water, you have to be really careful and look at the labels, because you can have more than 24 grams of sugar hide in a single serving. So that's the easiest place to start. And you just substitute with water. And thankfully, we have so many good water choices now. If you get bored of plain water, it can be sparkling water, flavored water, hint water. But that's the easiest thing for most people where to start, is to swap out the sugary drink for water.
Yeah, I think the other thing to remember is when you're juicing something, you're removing the fiber, and the fiber is what slows the absorption of that sugar. So aside from just concentrating it, you're taking out the piece that slows down the amount of sugar that's being dumped into your system all at once. And again, you're dumping all that sugar at once instead of letting it trickle in. And so naturally occurring fruit comes with fiber, or vegetables. A lot of people think that if I juice the vegetables, that's going to be better, right? Because vegetables don't have as much fructose as fruit does. But when you're juicing something, you're removing the piece that is one of the most important parts of that vegetable or fruit. And so juicing is just not a great way to consume your food.
And then another thing that a lot of people don't think about is that sugar in our processed foods in this country hides in a lot of food that we don't think of as sweet. So about 3/4 of all packaged foods have some added sugar in it. And what's really interesting is that when we got on this low fat kick in the 80s and started removing fat from products and advertising low fat is healthy, even low fat cookies and low-fat candies were thought of as healthier, when you remove fat from a product in order to have it taste like anything other than cardboard, often they will add sugar. And so if you compare products, you will find there's no sugar in the original product, but there could be a lot of sugar hiding in the low-fat version. So an example is mayonnaise. Real Hellmann's has no sugar, low-fat Hellmann's has sugar. You see this a lot with other condiments, especially salad dressings. And then you see, again, the cottage cheese, there's no sugar in real full-fat cottage cheese, but in low-fat cottage cheese, there can often be sugar. And yogurt, is really advertised as healthy. And some of those low-fat yogurts, again, can hide more sugar than your daily budget. And it drives me crazy with the Go-Gurts and the ones that are really aggressively marketed to children as a healthier alternative, when you would be much better just making your own yogurt concoction with real fruit, adding nuts, if you can eat nuts. And if you want even to put a little bit of honey in it, I can guarantee you a half a teaspoon of honey mixed in your yogurt is going to be a lot less sugar than what you buy in a prepackaged single serving of a low-fat flavored yogurt. And then, because I like the shock value of this and because it's St. Patrick's Day, again, we all know that a Shamrock Shake has sugar in it. I think people are shocked at how much. And the same goes, like I said, for a lot of the coffee drinks and a lot of drinks we don't think of as sweet. We know Shamrock Shake has a lot of sugar, but I'm sure people are surprised to see that it's 93 grams of sugar in a medium size Shamrock Shake. So remember, budget is 24 grams in 24 hours. I doubt, at least I know my children are not going through the McDonald's, drinking a third of it, coming home, putting it in the fridge, taking it out the next day, drinking a third, putting it back. So it's a lot of sugar. And if we have time at the end of our talk, I want people to guess how much sugar hides in the Portillo's cake shake, because I think that's the largest amount that I have seen.
Well, and remember, we said 24 grams in 24 hours, but that's 6 teaspoons. This is now 23 teaspoons. It's kind of insane. And so one of the things that you and I both do for teenagers when we give talks at high schools is we have them take, a nutrition label and calculate how many teaspoons of sugar and have them start putting those teaspoons of sugar in a glass jar. And I say to them, would you add water and drink that? And they look at me and goes, gross. And I'm like, well, that's what you're drinking when you drink the Shamrock McCafe, or you're drinking the Frappuccino or the bubble tea. Those are the same things, or the Coke. So, one of the things this is a kind of for shock factor, I think also, if you drank one sugary beverage every day for an entire year, how much sugar is that? And we can't get your responses, so we'll give you the answer, but that's 30 pounds of sugar. So imagine 6 5-pound bags that you have, hopefully don't have 5-pound bags in your pantry right now, or at least not 6 of them, but 6 5-pound bags that you're drinking over the course of a year. So now think to yourself, well, what if I cut that out? What if I just swapped out that one sugary drink a day, just 12 ounces a day, for something that's either water or a calorie-free beverage? How much weight could I lose if that's your goal, right? 15.5 pounds. So it seems like a very small change for very big gain. And so if you can substitute out that one sugary beverage for a LaCroix or a Spindrift or a Hint water or a vitamin water that has 0 sugar in it, something like that. And in some cases, we also will allow, we'll say to people, look, if you can swap out your Coke for a Coke Zero, that is a step in the right direction. That's cutting it out. And I steal this from Dr. Shahab all the time, but if Coke is your cocaine or your heroin, then Diet Coke or Coke Zero is your methadone, which is what's getting you off of the heroin. And so we know that sugar stimulates those same areas in the brain as a lot of drugs. And so if we kind of wean ourselves off of that, you can really achieve a lot. So just give that some thought. So a lot of people ask us about sugar substitutes as well. Are there actually metabolic differences between sugar and non-sugar substitutes? And we want to differentiate between sugar substitutes that are naturally occurring and artificial sweeteners. So your sugar substitutes that are naturally occurring are going to be your stevia, your allulose, monk fruit, xylitol and erythritol, if you guys have heard of those. They are now available in almost every grocery store, so they're pretty easy to find. And your artificial sweeteners are the traditional NutraSweet, aspartame, Equal, those packets that, the pink and blue packets that we're so used to in a lot of restaurants and in a lot of coffee shops. So even though we know through studies that it seems that these artificial and sugar substitutes don't actually trigger insulin, the release of insulin, which is that hormone we want to try to keep down, we know that they still trigger our sweet receptors in our mouth and in our GI tract. And so we tend to crave more sugar when we have something sweet because it triggers those sweet receptors. So even those artificial and sugar substitutes will trigger those sweet receptors. In addition, artificial sweeteners can also alter our gut microbiome. And there are a lot of studies coming out now on how the gut microbiome, which is all the bacteria that are in our gut lining our GI tract, how that gut microbiome impacts our metabolic health. And there's a pretty strong correlation there. And it can lead to what we call insulin resistance, which is basically pre-diabetes. And the bottom line is just substituting sugar is not enough. You actually want to decrease the consumption of all your sweets to be healthier. So, but again, making that switch to a sugar substitute initially so that you can reduce the insulin, change some of the hormonal signaling in your body so that you can be more successful getting some of that sugar out is a good first step.
Right, and like I said, I like the analogy with heroin and methadone. So if you need the methadone to get off the heroin, absolutely, right? That's ultimately going to be better for your health, but it's not a good long-term plan. And what Dr. Kirsten was saying, like if you need that artificial sweetener to break a, 3 sugary drink a day habit, absolutely go for it. But ideally you want to wean yourself off of that. And for children, none of these, and adults as well, but for children, we really have no idea the effects of these artificial sweeteners on developing brains. And we know for children and adults, they're not good for you. And again, you don't need them. So the master plan would be get off the added sugars. And then if you need an artificial sweetener, go that route. But the ultimate goal would be to just, as Dr. Kirsten said, just reduce all sweets and pick a more, and use your sugar budget for a natural sugar.
Yeah. The other thing that I've had some patients do is if you're really one of those people who drink several cans or bottles of soda a day, try switching to the mini cans at first, because sometimes, that just opening up a mini can and consuming that can satisfy that craving. And you've now had, a third of what you were having before. So every little bit of reduction gets you closer to that ultimate goal of really weeding that stuff out of your diet. So whatever you can do to reduce it. So we're going to shift gears and talk about another really essential, or rather, we're going to talk more about essential nutrients in our bodies and the things we need to eat in order to be healthy. We kind of started with what we need to kind of reduce to get out of our diet, because that's the biggest impact. But the other big punch is going to be protein. Protein is super, super important for our bodies because we can't survive without protein. It provides the building blocks for muscle. And muscle is what drives our metabolism. It is basically the thing that keeps us super, super healthy. Protein, if we eat the right amounts at the right times of the day, we can jumpstart our metabolism. So we know that getting 30 grams of protein at breakfast is the most important meal to jumpstart that metabolism. You've spent the whole night sleeping, not eating, hopefully, right? So ideally you're sleeping and you're not consuming food. You wake up in the morning, you want to turn on your muscle so it can work for you all day long. And we know that that pathway that needs to be turned on needs 30 grams of protein. So how do you get 30 grams of protein? Well, these are some examples, but ideally you're looking at, again, food that is more naturally occurring, not processed food that you're looking for protein. But if you're the kind of person who wakes up in the morning and really doesn't feel like eating, we're really talking about when you first break your fast. So it doesn't have to be first thing in the morning. It could be at 11 or 12 o'clock if that's when you first get hungry. Just the first meal, you should aim for 30 grams of protein. So some of these examples are like 4 ounces of meat, chicken, or fish. If you're looking for a breakfast option, a cup of cottage cheese or some eggs. If you're really more of a lunch person, tuna salad, chicken salad, egg salad, these are all quick meals. If you're more of a plant-based diet, you could do tofu or lentils. Those are all ways to get a good source of protein to jumpstart your metabolism at the beginning of the day and really get your body going.
And Dr. Kirsten and I also sometimes joke that we could call this talk "Things Your Grandmother Tells You," right? Get a good night's sleep. You know, grandma serves you orange juice in a little grandma glass, and grandma tells you to eat your vegetables. And the importance of eating vegetables, one is just we get a lot of our vitamins from vegetables, but we've talked a lot about fiber, and it's fiber that makes you feel full. And both vegetables and fruit have fiber, and Dr. Kirsten's going to talk a little bit more about fruit, but vegetables have a lot less naturally occurring sugar and tend to have like a higher fiber to sugar ratio. And you want to aim for 3 to 5 servings a day. And the easiest way to plan for that is just try to pair a vegetable with a protein for every meal and snack. And we have a lot of things listed, but people really ask me a lot about snacks because most people know they could have half their plate be a salad and half, their plate be a form of protein. But good snacks are just celery with nut butters or cream cheese, veggies with hummus. Those are good ways to pair a produce and a protein to get the fiber that's going to keep you, it's going to expand in your stomach, make you feel full for longer. And again, you're getting a lot of really good sources of vitamins and micronutrients.
Yeah, and I think also the protein, when you add it combined with the vegetable, you really get good satisfaction, right? And there are 2 pathways in our brain that have to do with hunger, with appetite. One is hunger and one is satiety. And so we want to satisfy hunger, but we also want to feel satisfied when we eat something. And that's why when you combine vegetables with protein, you really target both of those pathways, and you feel a lot more satisfied with your meal. So you're searching less for other items. So let's talk a little bit about fruit. I joke with people that I have fruit rules, but they really are fruit rules to go by because they help people understand better how to fit fruit into their diet. And fruit is important because it does carry a lot of vitamins and minerals that our bodies need. But we don't need as much fruit as we need vegetables. And so one of our biggest pet peeves is we don't like that the government combines fruits and vegetables into one category, because really vegetables should be their own category and fruit should be their own. But fruit is also a great way to satisfy some of that sweet craving without getting all those artificial sugars and added sugars into your diet. So some of the fruit rules are limiting your fruit to 1 or 2 servings per day, because that's going to keep that sugar down, and picking a low sugar fruit. And what we mean by that is fruit that has more fiber with it. So berries have those seeds, that's fiber. Citrus fruits have the pulp, that's fiber. Pears and apples have the peel, that's fiber. Kiwi has those seeds. So those are fruits that are going to be lower in sugar. And we want to avoid the fruits that have higher sugars, or at least limit those fruits if you're trying to improve your metabolic health, you have a tendency towards diabetes in your family, or know that your blood sugar is elevated, or you're trying to lose weight, then you want to limit these other fruits, which are bananas, melons, grapes, and tropical fruits like pineapple and mango. And if you always, again, pair that fruit with a protein, you're going to slow the absorption of that sugar. So some of those examples are listed here, and some of the I think one of the most common ones is a green apple with some nut butter, or some Greek yogurt with some blueberries. But you can do it in various different ways as long as you're pairing that protein with the fruit. It's going to slow the absorption of that sugar and give you the benefit of that fruit as well, but not stimulate the insulin that's going to lead to metabolic disorder in your body. Okay, so this leads us into a discussion about movement, and we deliberately leave movement for the last piece of the puzzle, because when you are either overweight or struggling with metabolic health, your cells are kind of tired. You don't have a lot of energy to move. So the biggest bang for your buck is going to be changing your diet and improving your sleep. But if you have that energy, and as you improve your diet and your sleep, you will have more energy. And then movement is really an important piece of the puzzle to keep your metabolic health going and to keep improving. So we know that in the United States, this is one of my favorite quotes about exercise and sitting, and this was a quote by the inventor of the treadmill desk, and it's very appropriate. Sitting is more dangerous than smoking, kills more people than HIV, and is more treacherous than parachuting. We are sitting ourselves to death. And it's so important for us to be moving, and we just have to move frequently. We don't have to kill ourselves at the gym. We just have to move more frequently throughout the day. And one of the things that the pandemic has done is taken that away from us because we are no longer commuting and taking trains, although hopefully we're getting back into that now.
So I'm just, for the sake of time, I'm just going to talk about this briefly, but I think everybody has this idea that in order to move, you got to get up, and go to the gym at 5 in the morning and spend an hour exhausting yourself on the Stairmaster. The recommendation is to get 30 to 60 minutes of some physical activity a day, but you do not need to get it all at once. You can get it in small increments, and it all counts. So easy ways to add activity: if you're on a phone call, get up and start walking around. Take stairs instead of an elevator. Park at the end of a parking lot. Any little thing you do. If you're listening to your favorite songs, rock out to it. But all of that activity adds up at the end of the day. And I think we all know, have that friend that we hate who's really skinny and very fidgety. Well, it turns out they're probably moving more than we think they are, and they're moving in small amounts all through the day. So that's really important thing to remember, is that anything counts, and that just making that small effort, getting up for your desk for a minute every hour, like you said, walking to another bus stop, all of it counts in the end.
So we wanted to leave you with really simple strategies that you can implement tomorrow. So we'll run through these. A lot of this is summary from what we've already talked about. So get a minimum of 7 hours of sleep every night. That is something that you should aim for. If you have to just increase by 15-minute increments, go to bed a little bit earlier each night to get to that 7 hours, just, kind of set that as a goal. Take a moment every day and be kind to yourself. We've all been through a really hard time in the last 2 years. And a lot of us are really anxious right now still about the future and about what's going on in the world. And so taking a moment to be kind to yourself can really help you reduce your overall stress. Remember your sugar budget: 24 grams in 24 hours or 6 teaspoons in 24 hours. Start your day with protein because that's going to jumpstart your metabolism. Get your veggies so that you can feel full and get all the nutrients that you need. And increase your non-exercise activity thermogenesis, your daily activity throughout the day.
And if you want to learn more or want help jumpstarting your metabolic health, please come and find us in the OrthoHealth program at Illinois Bone and Joint. And I think one of the things that we've found most satisfying working with this program is that we really help individuals, but we also help families. And it's a really nice program for all ages. So again, if you have any questions or want to learn more, you find us on the IBJI website.
I don't know if we have any questions, Karen.
Yes, we do have questions that have come in, and of course now they're all coming in. But I'll start with the ones who first asked questions. Can blood tests measure cortisol levels?
Yes. So blood tests can measure cortisol levels. However, it's actually important when you measure that cortisol level. So it has to be done at 8 o'clock in the morning or around 8 o'clock in the morning, because cortisol has what we call a diurnal variation. So it goes up and down throughout the day. And so you want to catch it at a certain time. And just measuring a random cortisol sometimes is not all that helpful. So you may need additional tests to detect if there's truly a cortisol problem. But again, you'd want to know why you're trying to measure that cortisol, what your goal is and what you're trying to achieve, because sometimes we can look at other blood tests that give us hints as to what's going on with your metabolic health that might give us more information than checking just a random cortisol level.
Great, thank you. That was very helpful. All right, the next question from Mary is is HSCRP used more these days as a measure of inflammation? Can you tell us what that is? I don't know what HSCRP is.
Do you want me to take this, Lynn, or do you want to?
I mean, it's your C-reactive protein. It is a measure of inflammation that we used to look at if somebody was having like an infection or a disease process to see the response to treatment that the inflammation is going down. But we are using it more and more to look at systemic inflammation, but we have other ways to measure systemic inflammation as well. And at OrthoHealth, we look at a number of different measurements. So that's not the only measurement to figure out if somebody has a lot of inflammation in their bodies.
Gotcha.
Yeah, and high sensitivity CRP is used to identify cardiovascular health as well, like your heart health. Unfortunately, CRP is not a very specific marker. So like Dr. Shahab was mentioning, you never look at one individual test on its own. We look at it in the context of all the other tests, as well as your own medical and physical health.
Great, thank you. That's very helpful. Thank you, doctors. All right, the next question is, do we add total carbs to total sugars for a total, I think that Mary's asking for a total sugar intake.
So yes and no. So again, when we're talking about the first place to start in improving your diet, it's really first focus on added sugars, because that's the easiest thing in your diet to get rid of. It doesn't matter what your weight is. Nobody should be eating excess sugar, because again, it leads to this cascade that can cause a lot of inflammation. And for some people, it can lead to a cascade that also causes a lot of weight gain. So when we talk about added sugars, it's the most simple way to look at it is just reducing added sugars. For people who have other needs or for weight loss, it gets a little bit more complicated about reducing carbohydrates, but that would, I almost don't want to go into the weeds with that right now. I just think if you're looking to a simple way to improve your diets, reducing added sugars. If people are trying to calculate their net carbohydrates, which I'm not sure if that's what that question was getting at, then you subtract the amount of fiber from the carbs, and that would be your net carbohydrate. But that could be like a whole in itself.
Right. You can get really bogged down. I think also it's really important to understand that there isn't an absolute amount that we can quote for carbohydrates, because every person's body tolerates a different amount of carbohydrates. So that's the beauty of the art of medicine, is figuring out, that's what Dr. Shahab and I do, is we figure out in our program, how many carbohydrates can your body tolerate before it tips you over the edge into a less desirable metabolic health pattern. And so where that total becomes is different for every person.
Gotcha. So sticking with the simplicity, just check on your added sugars and see you two to talk about carbohydrates.
Right. Added sugars, right, would be a place of where to start on your own. And then if you're part of more of a structured program, then we would individualize your carbohydrate intake, as Dr. Kirsten said, for your body.
Gotcha. That makes great sense. Thank you. Okay. This one says, hi, Dr. Shahab. It's Tracy and Grace. What are your thoughts on probiotics like Chobani yogurt or kombucha drinks?
So probiotics we're just at the tip of the iceberg of learning about how your microbiome, which is the millions of bacteria that live in your intestines, in your stomach, in your gut, affect your health. And so any way to improve your microbiome, we would recommend. So eating vegetables and low sugar will improve your microbiome. Having a probiotic or a probiotic drink can help, but you just have to be careful, because some of those probiotic drinks will have sugar added to them. And I think it's probably better, instead of having a drink, to try to just get it from a healthy diet. So if you have a healthy diet with a lot of vegetables and a lot of fiber and low sugar, your microbiome should be pretty healthy. And I get a little nervous about taking probiotics, because not all brands are equal. And it's, our supplement market is pretty unregulated. It is unregulated. in this country. But we start with food, and food is medicine. Eating an non-sweetened yogurt is a good source of protein. It's a good source of fat to keep you full, and it does have active cultures that will help your microbiome. But Dr. Kirsten and I both find this whole field fascinating, and there's even evidence. So we know that microbiome influences how we process foods. It might influence insulin. It might affect mood, because you have your vagus nerve that goes from your brain to your gut. So anything you can do to improve your microbiome will absolutely improve your health. But again, if you even just start with low sugar and fruit and vegetables and trying to decrease processed foods, that in itself will improve your microbiome.
So, one thing to think about is that there are studies that are coming out that are looking at prebiotics and how they support your gut microbiome. The prebiotics instead of probiotics. The difference between the two is prebiotics is the food that your gut microbiome feeds off of. And so the prebiotics are going to be all those vegetables and fiber and food that you eat. And probiotics is actually taking bacteria and dumping it into your gut. Since we know that the gut microbiome is like a thumbprint, it's unique to each individual. So that the makeup of your gut microbiome is your own gut microbiome. It's not identical to anyone else's. How do we know to make recommendations about what kinds and amounts of probiotics to dump into your system? So you're always better off feeding the bacteria that you have and allowing that good bacteria to overcome the bad bacteria in your gut.
Awesome, thank you. That was both of you. That was very helpful. All right, we have a few more questions, but it's already 8:04, and I'm going to switch gears real quickly. Linda asks, what about reading before bed with a Kindle with a black background?
That's actually okay.
Yeah, I was about to say, in this modern world, and also in concern for the environment, I can understand why people don't want old-fashioned paper book. And I think the key of what Linda said is that dark background. You don't have that bright light stimulating you. It's a great way to relax and unwind before bed.
Great. All right, so for a bunch of people said thank you and excellent information, and I don't want to keep the doctors late, and I don't want to keep our attendees late. So I will forgo the rest of the questions. I'm sorry to those of you to whom I didn't get this evening. I just want to thank you again, Dr. Kirsten, Dr. Shahab. Really interesting, really great presentation. I for one, feel like I learned a lot, and I'm sure all of our attendees did as well. And in closing out tonight's webinar, I want to invite everyone to mark your calendars for Tuesday, April 26th, again at 7 p.m. for our next joint Illinois Bone and Joint Institute and YMCA Education Series program entitled All About Bunions, hosted by pediatric foot and ankle surgeon, Dr. Paul Goodman. And again, on behalf of everyone in attendance this evening, and on behalf of the North Suburban YMCA, Dr. Kirsten and Dr. Shahab, thank you for your time and your expertise this evening. Until next time, please take good care, everybody.
Bye-bye. Thank you.